The World Health Organization has warned that the number of coronavirus cases will continue to rise in the next few days. Countries around the world have also advised against all but essential travel to China. Chinese villagers near Beijing's Shunyi district have blocked all entrances to the community. Residents were warned last week not to invite guests. Anyone who had been to Wuhan, the epicenter of the outbreak, was urged to register with authorities. The new, more severe strain of a pneumonia-like virus that emerged in China has meanwhile seen Shanghai residents flock to buy face masks. That's due to growing fears over the spread of the deadly epidemic. The coronavirus outbreak from Wuhan has claimed the lives of more than 130 people. Nearly 6,000 cases have been confirmed so far. Well, for more on this story, I'm joined in studio by our reporter Chriselda Lewis, who was at the minister's briefing earlier this morning. Thanks very much, Chriselda, for joining us. So essentially, the minister saying that South Africa is on top of the situation. Yeah. Should the virus come into the country, they have processes in place to be able to contain.
Well, that's right, Nompu. The Health Minister, Dr Zweli Mkhize, is saying there's no need to panic and that all the necessary measures have been put in place to ensure that screening at the airports, in particular for flights coming in from China, have been intensified. You would know, of course, in that intro that you read, you spoke about Wuhan province. And in Wuhan province, we now confirm that there are 35 South Africans who are in that particular city. And when we asked the health minister whether they believed there was time for the South Africans there to be evacuated in Wuhan as well as in other parts of China, South Africa says there's no need at this stage. They are in constant contact with the Chinese authorities and they've been given assurance that the situation is under control at this stage, and they're doing everything possible to ensure that it does not spread. But it's a bit difficult at this stage, if we look at it. According to the World Health Organization, the virus has spread to 14 other countries outside of China. So South Africa is really not, leaving anything to chance at this point. When we visited the National Institute for Communicable Diseases today, there's also an emergency center that has been set up in the event that there's a confirmed case or a threat of the coronavirus spreading to South Africa. That is a center where they will be able to basically do tracing on that particular case and try to assess whether or whom that particular patient would have come into contact with. Yeah. So all systems are certainly being put in place to ensure that in the event that there's a threat, a national threat in South Africa pertaining to the coronavirus, South Africa is able to deal with that.
We understand that a number of nations have decided that what they'll do is that when they suspect somebody's coming in with the coronavirus, they will actually put them in quarantine for anything between 78 hours up to 14 days. Did the minister speak to that, what they'll do with any suspicious cases, and where exactly they would house them?
Look, what we do know at this stage, Nompu, is that once a case has been detected or there's suspicion that somebody has the coronavirus, that person then, your temperature will obviously be taken as you enter the airport. If it is found that your temperature exceeds what it's supposed to be, a nurse will be called in order to check. And then if that is the case, the National Institute for Communicable Diseases will be alerted to that. And we understand that there are Charlotte Maxeke Hospital as well as the Tembisa Hospital have been put as a part of the hospitals that will be there to assist. So these quarantined areas where someone who is suspected of having this virus will be put have been identified at Charlotte Maxeke Hospital as well as Tembisa Hospital. However, I did point out to the Minister, Nompu, is that with the Tembisa Hospital, for example, just over the past couple of days, you've had questions being raised about, the hospital not being able to deal with the patient load that they have currently because they're severely understaffed. So what Minister Zweli Mkhize, Dr Zweli Mkhize, is saying is that you're looking at a section of these hospitals that will be identified where you're not going to have many staff that are going to be needed there. It's going to be a quarantined area in the event that there is a suspicion that somebody does have the virus. So in terms of quarantine, that's what will happen. We also saw as well in terms of the time frame of the quarantine itself, it's the very same time frame that has been put in place in places like Wuhan, because when I asked the minister whether South Africans in Wuhan, for example, which is the center of where the virus was first detected, whether they've been asked to be evacuated, he says there's no need for that at this stage, but there is a quarantine process first to check for symptoms before anyone is let out of the Wuhan city itself.
What was Home Affairs saying? Dr. Aaron Mwasoledi was speaking as well. We're putting a lot of emphasis on OR Tambo, but at the end of the day, all our borders are actually vulnerable because we don't know where the people who are coming through have come from.
Good point, Nompu, but the Home Affairs Minister, Dr. Aaron Mwasoledi, did not want to say much. It seems like the central point of communication here is going to be the Health Department, and he alluded to that in the press conference. So at this stage, all he could say when we asked about porous borders, I mean, you're not really going to get somebody from China, fly from any province in China to wherever on the African continent and walk through a border. So I think much of the emphasis is being put now on the ports of entry. So your OR Tambo International Airport, your Cape Town International Airport, the major ones which would have those international flights coming into South Africa. While in that intro, you also alluded to the fact that some international airlines have cancelled some of, the travel into their respective countries. When I asked about that, the World Health Organization, which was also present at the press conference, also indicated they don't see it necessary at this point to impose travel or trade restrictions despite the situation. But, at OR Tambo International Airport, for example, where you would catch a flight from here straight to Guangzhou or to anywhere else in the world, they're saying that they're going to really intensify on the screening, in particular for those incoming flights from China, because we asked a question and said, I mean, Hong Kong was one of, those areas that decided they were going to limit the arrival of aircraft from mainland China. We asked South Africa if they're planning to do that. They say they're satisfied with the communication they're receiving from the Chinese at this stage, and they believe that at this stage they will stick to the stance. But I guess they could change it as the situation unfolds and if it even worsens.
One last thing. What about South Africans going to China? We have very important economic relations with that country.
Fortunately, Nompu, yesterday I spoke to some South Africans who, in fact, both were scheduled to leave for China today. They're working in various provinces. You'd know that South Africans, some are English teachers in China. So the two that I spoke to are indeed that. The one was very skeptical about going back because she doesn't know what she's going to find. One of the other South Africans that I spoke to, who's been working in China for 3 years, says she's very concerned about the situation there. She's getting conflicting reports, from some of the Chinese who did not come back from the Christmas break. She's been here since December, so she's only returning now to what seems to be a deadly situation in that country. She's bought masks. She's bought food because she lives with a 7-year-old son in China. She's bought food and a bit of medication, for example, things to deal with flu and fever, which are some of the symptoms of the coronavirus. So, they're very uneasy about returning to China, but I guess at the top of their minds at this point is the reemployment in that particular country. So they have to return, but what we understand from them also is that some of the schools, the reopening of schools has also been delayed. Her 7-year-old son, schooling has been delayed at this point, and she says that some of the shops have run out of groceries. Hence, she's packed just some of the essentials, like your porridge and a little bit of aromat here and there. You know how we love our aromat in South Africans. But just some of the essentials and some of the medication that you'd possibly need for you and your child in the event that you feel a little bit woozy. But South Africans who are living and working in China are very, very, very concerned about the situation there, but have no choice but to return.
Chriselda, thank you very much for those insights. My colleague there, Chriselda Lewis.